staying with us. It's still the conversation, and this is the second conversation we're having on the segment this morning. We're talking the role of ILERA EKO in achieving universal health coverage. Yes, and that means healthcare is not a luxury. It is a necessity. Yet for many Lagosians, one hospital visit can mean financial strain, borrowing, or even selling out all personal assets. That will not be the case with ILERA EKO and with LASHMA. With us this morning, we have Dr. Emmanuella Zamba. She's a permanent secretary, Lagos State Health Management Agency. You're welcome.
Thank you.
For viewers just tuning in, and for those who do not even know anything, because everybody will say, well, we don't know about ILERA EKO. Can you just please give us a brief overview of what ILERA EKO is all about?
Okay, so ILERA EKO is the state's social health insurance program. It is set aside by government to be able to provide quality and affordable health care for every single resident within the state, regardless of your socioeconomic status or where you come from. As long as you live here, you do have access to ILERA EKO.
Okay, so what was the problem, government was trying to solve when they come up with ILERA EKO?
Okay, so I think it's twofold.
Okay.
The first is that many people are not very health conscious. Many people do not prioritize their health, and as such we do have a lot of people falling on unnecessary morbidity and mortality in Lagos State amongst our residents, and we know that it's really stressful.
In Lagos, yeah.
It is very stressful. The second thing was that when they do now get to the hospital, because health is expensive, whether whichever way you look at it, it is expensive. There are many, when you have to now pay out of pocket, you could end up being financially impoverished, just as you said earlier. We have cases of people, suddenly the wife develops cancer, or she needs to have a cesarean section they didn't plan for, and then they're running all over the place looking for funds to be able to meet that need. And somebody that was eating 3 square meals, before this health illness started, suddenly could be someone that can't afford to even eat once a day, simply because this accident in terms of their health happened. So really that was what government was looking at, to see how we can better protect our citizens, how we can make them more health conscious, plan for their lives, and of course not suffer financial catastrophe simply because life happened.
Okay, so one important question people have been asking is, how does ILERA EKO now differ from the National Health Insurance Scheme?
Excellent question. So National Health Insurance Scheme is set up by federal. They have their own aspects of social health insurance, which includes health insurance for their public servants in terms of their public sector. So all their public servants across all the states in Nigeria are covered by National Health Insurance. And they have other micro schemes. They also have the Basic Healthcare Provision Fund, which is distributed to all the states to be able to cover members of the vulnerable society within those facilities. So that's how, theirs are done at the federal level, and it is funded by the federal government. However, in the National Health Insurance Act of 2022, states have been recognized to be able to have their own state health insurance
Is it like
programs.
a support for what the federal government is doing?
I would not call it support. It's complementary.
Complementary, okay.
Yeah, because public servants live in
Lagos.
Federal public servants live in Lagos and other states. So they're covering their people. We cover our people under, that's the state public servants under ILERA EKO. And of course it is available for the general public as well as vulnerable. So even their vulnerable fund is not sufficient to cover everybody. Lagos State also has its own vulnerable fund called the Equity Fund, which we also use to complement whatever the federal government is doing to be able to cover as many people as possible within the states.
Okay, I want you to reiterate those who are now eligible, to enroll in ILERA EKO.
All right. So, according to the Lagos State Health Scheme Law, according to the National Health Insurance Act, according to the executive order, which was signed by Mr. Governor in July of last year, it says that once you are living in Lagos, you are eligible to be enrolled under ILERA EKO. The National Health Insurance Act says that you must subscribe to the social health insurance plan of your state before you go looking for other plans, quote unquote. So that's really it. You live here, you drink Lagos water, you breathe Lagos air, you are supposed to be under ILERA EKO.
Okay, so what's the process like? How do you now enroll? How do you become an enrollee into the ILERA EKO health scheme?
Okay, fantastic question. We have various modalities upon which you can enroll. You can go to our website. You can call our toll-free lines. We have a 24-hour call center. You can call on that. You can use our WhatsApp lines. You can walk into our main office, our divisional offices. We're everywhere, really. We're also partnering with private sector. So we have a lot of marketing agents spread across where you can enroll. You just visit our website if you're someone that is literate, and you can self-register. You call our toll-free lines, and then they will give you, where do you live? They'll ask you where you live, and they can tell you what office you can go to have yourself registered, and so on and so forth. We also even have a USSD that you can also use.
USSD.
Yes,
fantastic.
that is going live shortly. So we are trying to make ourselves as available, accessible, and as visible as possible for everyone.
Okay, some Lagosians, some people still believe that, you know, health insurance is optional. So what are the implications of low enrollment? How does it affect them?
So the first thing I would say is that it is no longer optional.
Yeah, of course, it is
By the
now.
executive order, it is now mandatory. And anywhere in the world, in civilized climes, social health insurance is mandatory. Anything else you have as private health insurance or whatever are usually complementary to the social health insurance. It is something that is standard. But in terms of, sorry, I didn't get the last. What was the last thing you asked me?
Okay, I asked that. What are the implications of low enrollment?
Well, it just means that the pool is not as robust as it would be.
Okay.
So one of the advantages of social health insurance is that the more people come on board, the wider the pool. You're able to increase the services that you're providing, because it's not for profit. It is just to cover people. So once you have enough money, you can now look at the services that you're currently giving. You can expand those services. So for instance, since we started in 2020, we've been able to add other things into the plan as we went along, looking at the disease burden and things that we see that are, you know, plaguing Lagos residents. We've been able to increase that plan over time to meet the needs of people.
So how do you, you know, pick or choose hospitals or healthcare centers, you know, for the scheme?
So the hospital you pick has to be empaneled by us. We have a provider network. You can either choose a public facility, you can choose a private facility across Lagos State. We have a network of about 800
what I'm trying to understand is, you know, most times you're given a list of hospitals, and sometimes your own private hospital that you use might not be in the list, and then you begin to wonder, why is my hospital here? So what is LASHMA? What were they thinking when they were picking these hospitals? So hospitals joining us are voluntary. We have not yet reached the stage where we're going to mandate all hospitals to sign in. Right? You know, things are done in stages. So to start off, we have people volunteering to join the scheme. Public facilities, private facilities across the state. There will come a time, of course, as this thing advances, especially since it's mandatory, that all hospitals will have to sign in to some extent into the social health insurance. That time will come, but it's not now. Abimbola, do you have something?
I was going to ask the PS. I know that LASHMA is trying so hard to get more people buying into this project, and some of the things that you embarked on last year include also, I might not be able to get the correct name now, also incorporating market associations and how people can also you know, pay you know, in bits, small right. So maybe you can also take us through that and how impactful or acceptable this has also been, especially to those at the grassroots who also probably have trust issues when it comes to government initiatives, and also trust deficit in processes such as this.
Okay, so that's a great question. We started what we call the ILERA EKO Cooperative Society. That started in December of 2024. And we partnered largely with the Lagos State Coalition of Tradesmen and Artisans called LASCOTA. They're an organized informal sector, as well as the theater arts. I think they call them TAMPAN. Those are the people that we started with, and also Ministry of Wealth Creation is also a stakeholder. So we set up this cooperative We have a board of trustees, and I think the president of LASCOTA is actually the chairman of the board of trustees. They picked people that would sit on that board just to inspire this trust that we're talking about. And LASHMA is merely on that board as we represent, so if they have questions for us, someone sits on that board as well. Right now, what happens is that you can sign up for that cooperative. You will pay your funds installmentally, and one of the advantages of that cooperative is that you're able to have your premium for ILERA EKO paid upfront by the microfinance bank that we partnered with, and then you get all the values in terms of you can get a short-term loan, you can get farm produce at less than market price, you can get they actually do like raffle draws and give out gifts and things like that. So there's added value to being part of that cooperative, aside from being able to have your premium paid up front by the microfinance bank that you are partnering with for the cooperative. So thus far, it has been very impactful. We've had quite a number of associations, so hairdressers and tie and dye association, etc. They come through that cooperative to come on board ILERA EKO. We just had a stakeholders or like a quarterly, so they have like a quarterly engagement where they sit down, assess, progress. There are things they want to bring up, etc. That happens. And we just had one, I think that was 2 weeks ago, actually, on a Saturday. So it's moving. We have Wealth Creation, as I said, joining us in that, and the volume of people that have joined through that vehicle has continued to grow.
Yeah, I'm still going to stay with the people, because usually when you try to get into the hearts and the minds of the people, sometimes change is usually very difficult to get into the minds of the people. So how receptive, especially those at the those we might consider as low-income earners, how receptive have they been to the ILERA EKO project? And have you also, what are the feedbacks you get from registration processes for a lot of them who might not really understand what it means to actually register for this? And also, has there been an increment in the patronage of health facilities, talking about the primary healthcare facilities, which of course should be the closest to the people? So has the ILERA EKO initiative helped people come back to the primary healthcare centers?
Okay, so that was quite like 4 in 1 question, so I might lose my train of thought along the way.
Okay, I can pick
all right, so we'll start from the last one where you said, has it helped in terms of
patronage at the
health centers? I would say yes, especially because we also have vulnerable people that now have the means of accessing care. Because they are being paid for by the government. So definitely that has increased the number of people that would go to the facility. Also the fact that the scope of services that the benefit package that we have covers is something that would definitely build traffic. People now have more courage. Normally, even if it's malaria you're going to the facility for, you would end up spending like 20,000. Right, but because you've signed up for this thing that is 15,000 for an individual, you know that when you go there, you'll get your drugs free, you'll get to see your doctor free, you can see your specialist. So definitely, patronage has increased across board. I would say that. Literally in hospitals, we have women having kids like it's like it's the new trend, really. Because you would find, they have the courage to get pregnant, and because somebody's going to cover.
Because somebody's going to cover.
Yes.
Is that also not indulging?
Is that exactly?
No, because we have women dying needlessly from doing it. People will get pregnant willy-nilly. Everybody wants to have a family. So yeah, people get pregnant, but at least now there's some level of...
And you're now encouraging them.
Yeah.
To have more.
Because we do also offer family planning.
Right.
And there are sort of like gatekeeping to ensure that you don't just abuse the system. Let me put it that way. Some of the policies that we came up with late last year was to do with the fact that we saw that people were now, trying to take advantage of the system. So we've put in some measures to gatekeep and help our women to help themselves, so to speak. Yeah.
Okay. So when people move residents, when they move from one part of Lagos to another, how easy is it for them to also change their healthcare providers, are there opportunities to change? If you need to change, what do you need to do?
So you are allowed to change your provider twice a year.
Twice a year?
Twice a year. You can change your provider for whatever reason. All we ask for is that you send us an email to ileraeko@lashma.com, or you make a phone call to the toll-free, to our call center, explain, this is my policy number, this is a hospital I currently use, I want to change to this particular one, and give us the reason why you want to change. And the reason is not because we want to prevent you from changing, we just like to use that as another avenue for feedback on these hospitals, right? So if a hospital, someone is moving away from that hospital and the complaint has been the quality of the care or whatever, then definitely we need to have eyes on that hospital and ensure that they're doing what they need to do. So it's as easy as that, really.
But do you sanction hospitals? Do you sanction hospitals?
Oh, yes. There is a whole arm of LASHMA in charge of regulations. So when we have hospitals that, infractions and things like that, yes, we have a whole list of sanctions starting from fines, suspension, up to delisting you. So yes, we do have sanctions for hospitals.
Okay, negotiants would like to know like a breakdown of what they will be paying, annually, compared to what they'll be paying out of pocket when they visit the health centers. I
think it might make a bit more for context. What are the benefits you stand to gain for the amounts that you're paying?
Okay.
So an individual pays 15,000 for a year.
15,000.
15,000 for the entire year.
For the whole year.
Entire year.
Okay.
Exactly.
Oh. Okay.
A family of 4, which is father, mother, and 2 children under the age of 23, or a single parent with 3 children under the age of 23, pay a sum of 55,000 for a year. And if you have a family of 4, which means you're a single parent with 5 kids, or you're married with 4 children under the age of 23, you pay 80,000 for the year. And the benefits that you do get from that are stuff like what we would normally walk into a facility for. We have a fever, we have a cough, I have pains, etc. Childhood illnesses are covered. If you're someone that has a chronic disease, so hypertension, diabetes, sickle cell, also we have quite a bit of sicklers also under the scheme. You can join us because you'll be able to get your monthly prescriptions, etc. We offer surgeries such as appendectomy, herniorrhaphy, etc. You can get glasses. I'm not talking about Christian Dior, I mean functional glasses. You can see a dentist, have your tooth filled, removed. You can have scaling and polishing done. Diagnostics, including ultrasound scans, are available. Whether you need a blood test or whatever, all those things are available. We also admit for up to 15 days in a year. You're entitled also to telemedicine, so you can sit in the comfort of your home and dial the doctor, and someone will talk to you, walk you through what you need to do.
Wow.
Of course, your drugs are available. You can have a baby under this scheme, whether it's normal delivery or cesarean section. You can have your child under this scheme. So there are so many benefits. By the time you join us for the 2nd year, you can also have coverage for there's the misfortune of cancer, for instance, or a renal condition. You can have dialysis done. You can have us pay for some of your cancer care also. So there is a whole gamut of things that you can get. And I mean, let's be frank, for that amount of money, that is
that 15,000?
That is a deal.
I was shook me and threw me off completely
you
for a
cannot
year.
afford to miss.
Okay. Does ILERA EKO?
We can talk about the benefits, the numerous benefits which you've enumerated here to the patient.
Okay.
And then the hospitals on board. What do they benefit?
Exactly.
And how do they And how do they also come on board? When do they need to also approach you? Do you work in collaboration with a farmer in certifying that they are up-to-date hospitals? So let's talk about. I always ask more than one question. So let's take it one by one. Benefits to the hospitals and how the hospitals can also be on board.
Yeah. So the law says you have to be HEFAMA accredited to be able to join the ILERA EKO provider network. So that's a done deal. You must have accreditation from HEFAMA. When you come on board, when you write to us to tell us that you want to join the network, we now have another layer of quality inspections that are done to your facility. So pharma accreditation does not necessarily guarantee you being onboarded as a provider for ILERA EKO. They will still come there and do another layer of investigations and so on and so forth. And if you meet the cutoff mark for a quality index, then you can come on board. And what are the advantages? Insurance is a game of numbers. So the more clients you have, the more you do get in terms of remuneration. We pay providers through two major payment mechanisms. You get a capitation and you have fee for service. So the capitation is we pay you a certain amount of money per the number of lives that have chosen your facility. So if your facility has, for instance, 10,000 people empaneled into your facility, you get that fixed sum times 10,000 people for that month. And that is paid to you upfront every month.
Every month?
Regardless of whether that patient comes to the facility or not. You are paid that amount upfront. And we do make sure that you get your money latest at the 7th of every month. Then there are services that are covered under fee for service. So if you, for instance, delivery. So if you have administered that service, you send us a claim, and then once you have 30 days to submit your claim, and 30 days after that, we are able to pay you. So that's like a 60-day sort of window within which you will get the additional funds for those additional services. So I would say that not many providers are very health insurance exposed. So people, they try to look at it from how much did I spend per person, forgetting that you're actually getting money for the blanket of people that are under your facility. So eventually you reach a cutoff mark where it is very lucrative. So we have some providers that started with us, and some of them are counting 20,000 people, 30,000 people, and they're smiling every time we call them for programs or whatever, you know. So it's a win-win, as long as we also have another initiative that we started where you can grow the number of lives that come to your facility on your own. We make you an enrollment center. So we'll train some of your staff, because that's part of what the executive order says anyway. When people walk into your facility, you're supposed to ask them if they have health insurance, and if they do not have, you're supposed to ensure that they do get registered and enrolled into ILERA EKO before they leave your facility. And so you also get a commission for every life that you bring on board ILERA EKO, separate from the capitation and the provider payment. You will get a commission for that action that you did. So it is a win-win for hospitals.
Just to follow up to the question she asked for the health facilities, what about some health facilities who say no, we don't want to get involved with the scheme? Is there any penalty, or are all health facilities mandated to join the ILERA EKO scheme?
No, not all facilities are mandated. We do have facilities that are very high end. Mention a few of them, like the Evercares, and those are meant to my mind, serve people that are wanting the aesthetics, and the social health insurance is about functionality, quality, but functional quality. You will get treated well and you will get cured, but not with all the bells and the whistles. So certainly hospitals that offer the bells and whistles would not want to enroll with ILERA EKO, because they're expecting
he lost
a
everything.
huge bill, and which is not what, as I said, we're not for profit. So that is not what social health insurance is about, really.
Before we go, because you're here today, are there things that you've heard
misconceptions
that clarify this morning? Are there links out there that people could be susceptible to links not emanating from LASHMA or people impersonating the organizations? Are there things that you'd like for Lagosians to be aware of about LASHMA this morning?
I like that. I think one of the first things I'll mention is that if you're on ILERA EKO, I expect you to join the social media. We're everywhere, really. And you can always call and check before you do anything. We had a recent incident of some, I don't know where it originated from, that had to do with public servants, telling them that they could go to a particular portal and register themselves, etc. That was totally false, and we've come out to debunk that. But I expected that, you know, since that it was not in the circular that was issued, etc., people should not have just taken it on board and, you know, got themselves entangled in something that is wrong. So that is the first advice I would give. We have social media, we post all the time. If we have any policy updates, new updates, those are the places to go and ensure that you're getting the correct information. One of the other things is that we do not collect cash. We are entirely cash free because we do not want stories that touch the heart, as they say. So you can only pay to the designated channels, which the money goes directly into the Lagos State Health Fund that has been set aside for this purpose. We do not ask you to pay to staff, be it a LASHMA staff or a hospital staff. You are not supposed to pay into anybody's personal account. There is nothing like an administrative fee. So if someone is telling you that they're going to enroll you and you need to pay, I've heard stories of people paying as much as even 10,000 as an administrative fee to be able to come on board. There is nothing like that. There is no administrative fee. There is no processing fee, and do not pay into personal accounts. Those are the things I would say.
Do not pay into personal accounts. You've heard it all from Dr. Emmanuella Zamba, Permanent Secretary, Lagos State Health Management Agency, LASHMA, and we've been talking about the role of ILERA EKO in achieving universal health coverage. Thank you very much for joining us this morning.